Okay, now we're going to turn to one of our big topics, which is the issue of membership. And we're going to start out by hearing from our membership chairperson, Bob Nicholson, about recent activities in progress.
I'd like you to look at the report that's before you, and we're going to walk through this, and I'd like you to hold your tongue until I finish, please. There's always some hecklers in this group. Our total membership active is 1384. You see the breakdown there. You see the new member of the breakdown, individuals and lifetime. And the most startling, and I really want to get something. Forgot to give the former president. I brought the rose petals for her, but I forgot them in my room. The most startling thing, I'd like you to look me in the eye and listen to this. In the United States of America, the majority of states have no NACRA members. I almost want you to repeat that like a litany. In the last 2 years, we have gone from 0 in states like New Mexico to 1 after my visit, and we're now at 9. And an enthusiastic resident council president at El Castillo in Santa Fe reaching out to La Vida Llena in Albuquerque. That's the kind of pioneering work that will make NACRA come to life. Jack's over there, quietly, with his lovely bride. They're up to 38 at Monarch Landing in Naperville. With 10 others in Illinois, it will top 50. That's up from 0. Are you hearing what I'm saying?
Yes.
Up from 0. It happened that I was with, I called Mr. McMasters in Carmel, Indiana on the phone because I look at membership stuff, and we had 1 member in Indiana at the Barrington. Doesn't that sound impressive? The Barrington. And I thought, am I good enough to go there? Do I have enough money? And I said, you don't know me, but I'm the membership guy from NACRA. I'm going to be out in that neighborhood. Can I stop by and have coffee? Scared the man to death. Where are you from? I said, Seattle. Well, my nephew is the pastor of the Christian church 47 miles away. So we visited him and went over. He gathered the whole resident council together, and we spent 3 hours together, including lunch, going into what is NACRA and what it's about. We will go from 1 member in Indiana to at least 8. In Washington and Oregon, 2.5 years ago, 0. Gerard Highland has done a spectacular job in Oregon after our visits, and there and in Seattle, you'll see that from being the nobodies on the list, Washington now is at 147 members. There is energy that comes when people come together. Now, I wish we could adopt a plan that says everybody in VACRA will be a NACRA member, everybody in FLACRA will be a NACRA member. And I get a lot of pressure saying, why don't you get these state associations to just join NACRA? It takes personal, face-to-face, on-the-ground diplomacy. And that's what we all have to do. So that's my rant and rave for today. But if you'll continue, I have tried to document for you what's going on in Ohio, my visit to Otterbein and to resident leaders there, my visit to Hillview in Portsmouth, Ohio, and to Bristol Village, where Mel Grossman had over 50 people night before last, and I addressed the community there. And that, again, is up. If Jack started, I don't know, how do you get to know Mel?
Mel wrote to Bennett Napier
Yeah.
and had a question that was referred to me.
All right, and out of that one little spark, Bennett to Jack to Bob, they're up to over 50 at Bristol Village, and they're trying to reach out to Hillview in Portsmouth, reach over to Outervine, reach to number 10, or 10 Wilmington and Dayton. And then in Indiana, I've got that documented, and there's a special thing here about Jack the Marvelous in Naperville. New Mexico, El Castillo, with a quote from the resident president there. In Missouri, we've gotten, I mean, you need to, I can't emphasize this enough. 2 years ago, I went to Lenore Woods, which was a Disciples of Christ, CCRC, owned and operated by the National Benevolent Foundation, and the foundation went bankrupt, and all Disciples of Christ CCRCs went bankrupt. Not unlike Sears. And so I went and I met with people, the chaplain, the director, the resident council, and in spite of all of my magic and eloquence, nothing happened. I'm used to it. But last month, I got a letter. I tried it, and I keep following up emails. What's going on? How's it going? How's the chaplain? I sure enjoyed my visit. And Shirley, the resident president, had a stroke. I wrote a prayer, sent it to her, you know. So finally, Lester Richley has written a book on the bankruptcy proceeding through which they went and in which the residents took a significant part and represented the residents in the bankruptcy proceeding and enabled, in a way I don't understand, Jack will explain it to you, and he documented in a book he published that the Missouri Synod Lutherans bought the place. They have a great executive director, a great chaplain, and it's a very open community in contrast to what you think of Missouri Synod Lutherans, which is a justified thing to think. Except there, it's not true. They are very open and welcoming and have a vital community. So we're up to 1 in Missouri after 2 years of work. Calculate that on a per hour and productive basis. You know, it's not. And Jennifer there is starting it up in Texas, in Washington State. You can see it. And here is your action guide to help in this important task. In Nashville, if you keep going, even our visitors, I think, do our visitors have a copy of a letter that says Nashville on it? Mm-hmm. Yes or no?
Yes.
Yes, all right. Here are some deathless prose from our noble leader. And the idea here is that we will have packets that will be available to anybody we come in contact with that says, welcome to Nashville, here's what NACRA is about, we want you to be a part of what we're doing in the world. And if I can think about this, my room is covered with literature. There's no room for the bed or the chair. Ruth and Bennett sent me 3 boxes full, and I unpacked them, and I don't know where to sleep tonight. But we're putting together a packet that includes this, the enrollment form, and always the self-addressed envelope. And we'll have them available for everyone at the 9:30 a.m. Sunday NACRA meeting. We'll have them for everybody at the 12 o'clock leading age luncheon meeting. We'll have them at the booth that we're going to have in the exhibit center. And I hope I'll conspire a little and we'll go. We have one of the seminars is on resident councils. And of course, I was in contact with a person who didn't know what the hell NACRA was. I mean, we're only the resident association in the country, but nobody makes that connection. And I said, well, yeah, you need to come to our meeting. Well, we're not coming until Sunday night. So I'll be there with bells on, and I've made an overture in email to them, but there again will be a group of people just like we had in Dallas and we had in Denver, that providers that come to learn about resident issues relating to residents and what they can learn from residents. So everyone should have at least, we'll have some more of these at our booth, but wherever you go, when you go to the bathroom, to coffee, to lunch, to one of the seminars, have some of these available with the self-addressed envelope, and the people can then fill out the application, put it in the envelope with their check, deliver it to the booth in the exhibit hall, or mail it in. Everybody here is commissioned, set apart, And if you need to, I can have the laying on of hands and sprinkling of water to participate in what we are doing. One other thing, late breaking, is that in membership development, the two jewels that people say, no kid, I don't believe, are Marlene and Lifeline and Jack and our NACRA-U. And Jack has developed a marvelous piece that you see there. And people say, well, what am I going to get out of this? Well, if you're alert, if you're alive, and you want to learn and be engaged and know what's going on, NACRA-U and Lifeline will help you immeasurably. And that is the end of the lesson. I will reluctantly but gracefully take questions.
Friends, we do have time for discussion. Just before we ask Bob questions or make comments on Bob's presentation, let me just sketch out for you some of the other aspects of membership which we will be discussing so we can sort of have a coherent view, and you may have even other aspects. First, we have the progress report from Bob, which we just heard. We have a pilot project report from Bennett Napier, which we wanted to discuss. We want to discuss a possible alliance with Cigna. We want to discuss our relationship with Leading Age as a membership development, an aspect of our membership development. There is some developments on direct mail and on advertising, and then there's my speaking schedule, which are all sort of parts of this. And finally, there's a discussion of membership and the bylaws. So this is, I just want you to have the idea that this is a multifaceted discussion of membership, and it was important that we start with Bob first. So why don't we take questions now about Bob's report and then move on to these other topics. Joe.
Bob, are your figures face-to-face only? There's not the pilot project included in those numbers?
Everything that I have done, I do, this is the buzzword, you ready? I do transparently. Every place I go, Dan knows about and Bennett knows about, so that if I'm in Indiana following up our one member there, and if there are other communities, Bennett ought to tell me about it, but he's told me nothing anywhere I've gone, so I never go anywhere without.
You got this report from him?
Yeah.
Yeah.
No, I got the report.
Yeah.
But I mean, if he were to say, you know, we got a nibble at East Tennessee, something rather near Nashville, I'd make it a point to get there. But I don't have any input from his pilot project to what I'm doing.
Joe, to answer your question though, as I read Bennett's report, if I understand it correctly, he has given us an up-to-date assessment of the membership growth and has clearly stated that it's impossible to comb out from those numbers what results from the Reach Out project, what results from the pilot project, and what might result from any other outreach. So unfortunately, we have no way of identifying which new members come from which source.
And
But my conclusion is that over the past year, with respect to individual memberships, for example, we've had a net gain of 184, or about a 20% increase in individual membership as a result of the face-to-face initiative. My question to Reverend Bob is that what were your expectations a year ago, relying on a face-to-face initiative and all of us participating in that? What were your expectations for membership growth?
He asks that question at every board meeting. Listen carefully, when there is no budget for membership development, it is nearly impossible to make projections. Go out, get us 10,000 more members, and make something up. How many do you think you'll get? There is no way under God's heaven to do what He wants to hear. What you do is you read the tea leaves and you follow hunches and you look at your own personal schedule at what is going to come up this year. We did not know we could see Betty's aunt who's suffering from dementia. It's probably the last time we'll see her. So we built a trip around that, and she's in a CCRC, so we called on them. Well, if you call on that CCRC, there's one over here, and then your nephew's over there, and she used to date a truck driver in Portsmouth, so we went down there. I don't say that. She'll kill me.
Yes, you will.
Huh?
Yes, you will.
Thank you very much. But we were visiting this distinguished doctor of internal medicine who was referred to us. Here's the way you have to work. See, we didn't have anybody at Hillview, and Mel Grossman had made an overture to Hillview, and with all the other overtures, the executive directors, deep-sixed it. So the resident council didn't know anything about NACRA or Mel Grossman or what's going on, and we didn't have any members there. So I called the Presbyterian minister where Betty's father had been the minister and said, "Do you have any members there?" And he said, "Yes, go see these folks." And fortunately, it was an outstanding doctor of internal medicine that had a law degree, and he was very welcoming, and he got the picture right away. And then we were talking to him, and we were talking about different people, and his best friend that he was fishing with had just died, and he mentioned his name, and Betty said, "I used to date him. He was a truck driver, and he taught me how to drive an 18-wheeler. And the guy anyway, but I mean, there's no way to do it, Joe.
I understand if you don't have a budget, you can't have a plan. So my second question is, assuming that situation doesn't change, we go another year without a budget, what is a realistic expectation of net membership growth? Around 180 to 200? Is that a reasonable projection given the cards that we're playing now?
I think the answer should be, what is the projection that everybody in this room can make of what they can do? And I have in here a sheet for them to document their plan so that everyone has the opportunity. I can't find it here, but you've got it there. My plan for membership recruitment. How many people will you and you and you and you and you and you do in the coming year? Tell me, and then I'll put but I mean, I'm telling you, it is a responsibility of everybody around the table to be engaged in this endeavor.
Jack?
I think we may be getting off a little bit into the weeds here. We're not a long, well-established corporate structure that goes along from year to year with predictable results, the one year following from the preceding year. John Dulcimer, our treasurer, has put together a budget, and he's trying to track our costs relative to it. Bob has made the point that at this stage in our progress, we have to be largely expedient. I think that's true. We also haven't mentioned the chapter program, which has brought in a large number of members, including Mel Grossman, who takes great pride in being part of a chapter and having built a chapter. And, that is the engine for growth that the Florida organization used to build itself. It was initiated, as I understand it, by Bennett Napier, and it was our hope that he would bring that model into NACRA. And we do have a program, but it hasn't been fully supported, as you can see by the silence here. As I read the document, Bennett has been conducting a bit of a direct mail program, and he can count 13 members from that progress. Now, if we can build on those 13 as seed points, that would be something. The board has not deliberated at all on the possibility of bringing the members from the state associations into joint membership with NACRA. That issue's been on the table for the past 3 years, but it has always sort of slid off the table along the way. And so to sit and try to project, as you might project for a long, well-established, 100-year-old corporation, what the results might be, where you say each salesman's going to produce so many sales, and that's going to this and that, and you project out your results. for NACRA, which is still run very much on an basis of expedience, I think would be difficult to accomplish. I think we have a great deal of seeds planted. We have new people coming from new areas. We have a growing awareness of the issues that confront CCRC residents. That's a message that we have to get out in the face of complacency. You can't build membership by saying, we want you to be a member, we have a wonderful organization, come join our organization. I want to know, what are you doing? What's the purpose of the organization? So I think until we really address all these things and get on top of it, it would be presumptuous to say, here's the number that we project. Well, you didn't deliver on the number, you're fired. That would just be a wrong way for us to go. I think we have to be grateful for the service that we receive from everybody working in this organization. They're all a blessing, they're all giving of their souls, and we ought to be thankful for everybody who's helping out.
If I could just make a comment from the chair. There are estimated to be 600,000 CCRC residents in the United States. And of those 600,000, 1,300 are members of NACRA. And NACRA has been in existence itself for about 13 years, I think. So over a period of 13 years, we have 100 residents per year kind of to show for it. Now, clearly, our huge strategic dilemma is how to reach 600,000 people and offer them the opportunity to join NACRA. Even if we only had a 2% response from 600,000 people, we'd have a much, much larger organization. And the problem, the essential strategic problem, it seems to me, is that we are working diligently and inspiredly, as Bob has just described, on a word of mouth, one person touching another person method. We are not using 21st century methods. We have not found a way to do so. There is apparently no database, for example, of CCRC residents. There's a database of CCRC executive directors, but there's not a database of CCRC residents. So we are left at this point, although I have some suggestions that I'll bring up later on, with a word-of-mouth, person-to-person growth strategy, which is not going to get us to 600,000 people in any foreseeable future. And that's the dilemma we have to solve. All questions of organizational development, of organizational growth, hinge on that single question. We have a good mission, we have good programs, we provide excellent services, we have a wonderful newsletter. Everything else is in place. The issue is how to reach the potential constituency. Yes. I'm sorry, I did recognize the guest. Walter, is it okay if you give him a guest before you speak? Okay, go ahead.
Esther and I are the membership chairman for our FLECRA and NICRA organization in the Estates of Carpenters.
Right.
We have 149 members in NACRA. Is there anyone else who has any more than that?
No.
No.
And one reason you do is because of your leadership, but the other is that you give the residents the opportunity to check that they want to be a member and their annual fee is paid or deducted from or added to their bill, and there's one check issued to NACRA, so that it's not, you've got to fill out the form and put it in an envelope and go through some steps. You've made it easy.
Bob, let me, I think I need to correct you.
Well, I need correction.
We went out to get FLECRA membership. Now we have 2 pages of things that FLECRA has personally done for each personal individual. We've saved on bed tax, we've saved on meal taxes, we've saved on telephone taxes, and all the things that they've done through the legislature over the years. There are 2 pages of those. So we go in and we talk to them about what FLECRA does, and of course they want to join FLECRA. And of course, I say that, well, then you can also become a member of NACRA. And they asked me, well, what does NACRA do that FLACRA does? Basically, it's just, they do on a national level what FLACRA does. And it hurts me to a certain extent to say that because I know it's a big lie. But at the same time, I tell them that basically that's what we were set up for. NACRA was set up to do nationally what the state is doing for us in Florida. And so we were able to get 50 new members through this last campaign. And also we were able to get them all on a month of September. They pay their membership on the month of September, and they pay it through authorization.
That's what I'm getting at.
The office pays their dues, and found out that was necessary because some people were paying dues 3 years in advance. They didn't realize that they were paying dues that much. Some people didn't pay it at all because they forgot what it was. And so you do have that kind of a problem with the age group that we're working with. So if we put it on, every year, it comes on their bill, their monthly bill, and that's it. Now, also, what we were just talking about is that we have another CCRC in our community, which is the Florida Presbyterian Homes. They're getting along great, doing fine. They bought one of our resident memberships, and so they have a resident membership. And they feel like every member in that community is a member of NACRA. And here I am taking money across town, $20 from our residents for individual membership. And I think it was a terrible mistake to put in the bylaws that this was something that people could do. We also pay our resident membership. We pay $200 for CHIRA, but that's for our resident organization, period. That's not for membership. We have individual membership, which is important. And I'd just like to say that.
I think that's a good point. And I need to tell you, I personally visited that Florida Presbyterian home, and we had 0 members. So at least we laid enough foundation to get their attention to have a community membership. So again, it was face to face. And I said, you mean you don't know? I said, have you heard of the Carpenters?
Well, it seems to me there are two issues here. One is that I'm not sure that we can make too tight an analogy between the experience on the state level and you might say a strategy for growth on the national level. I've been in 2 places recently. One was in Maryland, where the state is relatively small. People can visit each other, they know each other. It's a different, and in FLACRA, where Bennett, traveled around and could personally touch people. When you come to the whole United States of America, I'm not sure that you can make an analogy with the growth process of a state association on the national association. The second thing that I think is an important issue here is what is the meaning to NACRA of these different kinds of membership? To me, and this is only my personal opinion, only if we have the name and address and contact information for individuals can that be a meaningful membership. If we cannot communicate directly with the person, from my point of view, their membership is a very weak one. Unless we can mobilize them, tell them what we need, tell them when there's an action. If we can't communicate with them, if our communication is only indirect, if our communication is only that 500 people get 25 copies of the Lifeline, that is not a meaningful membership from the point of view of NACRA's own development. So I think we have to be careful about these different kinds of membership. When I go speaking, I only talk about individual memberships. Now, you may fire me for doing this, but I don't find it meaningful to get group memberships where we do not have the contact data and we do not get the checks. That's not meaningful to me. Okay, I see several hands. I'm going to call on Bob and then,
Well, I wanted to just clarify something.
You're behind that wall.
I'm sorry.
Okay,
you
well,
very
could I
much.
clarify something he said? Because otherwise it'll be ungermane. You can either recognize me now or skip it, but I was going to correct something that Bob Smith said.
Okay, let's have a correction of Bob Smith, but then I'm going to turn to Walt because he's...
Is that okay, Walt?
Yeah.
Yeah. Bob alluded to the bulk enrollment, which was written into the bylaws. The thought there was that there could be merit for established state associations in having one bill, one membership that would include both state association membership and NACRA membership, but that would include this individual information that Dan has alluded to, where the state association could list their people and submit it directly. For FLYCRA, we thought the fact that Bennett was doing the administration would allow those economies. Charlie Palk, in his role as executive director, went to Bennett and said, what would be the economies if there was one bill instead of two? And he got a number. I don't know what the number was, but that was the impetus for that. The idea was not that you pay a flat rate and everybody's in. It was that you might get a reduced rate if they have Lifeline delivered electronically or in combination with the State Association newsletter. There are a number of economies that can come, just as with AARP, you're both a member in the national organization and in the state association for a price that's much lower than NACRA's price.
Okay, thank you. Now, I do want to, I'm trying to, on the one hand, I wanted to absorb everyone into a conversation, but I do want to be sure that we acknowledge that the board members really should speak first. So I'm going to call on Walt, and then we'll turn there to George.
Thank you. I wanted to add to something that Jack Cummings said earlier. He mentioned the associations, and I would like to add to that he mentioned the community organization. I want to add state associations as well. I would like to suggest that we invite the chair or the leader, whatever title they may have, of each of those associations to come to our annual meetings and try to arrange for them to come and talk to them about membership. Recently in North Carolina, I did a survey of an analysis of our membership. There are 58 CCRCs in North Carolina. Florida outweighs us by a long stretch, and so does Pennsylvania and a couple other states. But we have members in 39 of those 58, and we're growing. We just added another CCRC, actually 2 CCRCs this year to that group. And we are encouraging our representatives at each CCRC to promote both the state organization and the national organization. We did get a considerable boost this last year because of our efforts to promote legislation favorable for seniors in the state legislature in North Carolina. We've been doing that for 2 years. We're going to be doing it again this year. That seems to have rung a big bell with our people. The analysis I did showed that in the 39 CCRCs that we currently have members, we are about 32% average membership. The largest membership was 88%, and the smallest was still less than 1%. At the annual meeting this last week, I challenged those representatives to go for 50%. And I also challenged our regional chairs to get as many of the non-member CCRCs involved as possible, as we can, and indeed push our growth. I would like to suggest that we invite those people we know of right now who are state representatives, state presidents or leaders, and the, 39 community association leaders to come to our annual meeting. And we put together a story for them, not just should people belong to NACRA, but we need to convince them that what NACRA is doing. One of the things that we're going to be discussing today is this issue of hospital stays. You know, whether you're a visitor or whether you're actually admitted to the hospital, what the difference is and what it means. The fact we're going to try to get those regulations changed so that everyone going to a hospital is automatically admitted under Medicare. And that's the kind of thing that gets membership, is when you can tell them that you're impacting legislation that's influential to them. I think we should stress that in our efforts. Thank you.
Thank you, Paul.
Could I
George?
just ask a
Yes,
clarify
go ahead.
a number here with Walt? You say there are 58 CCRCs in North Carolina.
Yes.
39 are members of the North Carolina
Yeah.
Association.
39 CCRCs have residents who are members in North Carolina.
Well, they have residents who are members. How many are community members?
We do not have community members in North Carolina.
Oh, there's no such thing.
All we have are resident members.
Okay, thank you.
George?
I simply wanted to put the point of how difficult it is, I think, to motivate people to get out and do precisely what needs to be done. In VACRA, we've been talking about this for years, but to find people who are willing to travel down south or down west in Virginia to spend a day and have contacts and talk. We've tried from time to time. There is hostility on the management side, we understand, in the States, and we certainly find it in a sense, because we've had people who've called the executive director, because that's the only number we had for a community, and they've been turned off so fast they didn't even know they made the telephone call. But to find people who have the energy to take 2 days to drive to Roanoke to see a particular community and then come home, you wouldn't think that it really would take all that much. You could have a person make 2 or 3 trips a year, and if you had 5 people doing it, goodness, you'd have.
I would agree with you that it is difficult to find those people, but I can name one that's here today, Brenda Tremolay, who has, how many have you visited, Brenda?
23.
23 CCRCs in our state. She has personally visited. But the thing that really sells them is the fact that the organization is doing something positive for them. That's what influences residents. And the fact that we have been doing things positively with the state legislature for the residents, and they can see it in terms of their monthly bills. I mean, we killed a property tax and state sales tax thing last year that would have resulted in between $1,000 and $2,000 a year being added to your monthly fees. That impresses people, and that's one of the things that's gotten us members.
That may, I understand that, and I think it is terribly important to show people that we do things. In Virginia, it's kind of tough. It goes back to the time when we were fighting taxation successfully with a number of other states. And that was good, lasted for another year. And then mentioning it now, it's kind of meaningless to the people who've come in the last 10, 15 years after that was accomplished. The Virginia legislature, by and large, doesn't want to take on new things. The idea that legislation to cover the management, the funding and representation and so on of CCRCs, it isn't there in our legislation. They prefer not to put it in. Their big hope is that we would make friends with the management association and resolve our differences there, and the legislature wouldn't even have to deal with it, which is very unrealistic.
Joe?
As I listened to this discussion, I related to our experience in Connecticut. We have 17 CCRCs in Connecticut. All are members of the state association. At every meeting of the state association, we regularly delivered to the presidents of each of those councils representing those 17 CCRCs in the state. We deliver the kind of message that we exchange here at these meetings. We utilize material, as we did at the last meeting, showed a video that Jack prepared that highlighted the value of NACRA-U. That was very well received, but this is not translating into membership. Perhaps we're poor salespeople, but something is wrong here. You look at Florida. In Florida, they have 13,000 members of the state association. 319 are participating in NACRA as a resident member. That's 0.4%. We have 183 members in Connecticut. That's about 4%, 0.4% of the total population of residents covered by these independent living residents covered by those CCRCs. Something's wrong here. In all due respect to the great effort that Reverend Nichols and others have made, and this face-to-face, it's just not realistic to expect that we're going to have any significant presence in terms of numbers of residents on the basis of the plan that we have today and the plan that we've operated on for the last 3 years. It isn't going to happen. And we have to confront that and be honest with ourselves or accept what we have. We're limited in our resources, and we're not going to make any inroads into that 650,000 population across the country unless we have a viable plan to get there.
Have you a plan?
An annual, a 5-year plan.
Okay.
A good strategic plan would cover 5 years.
No, he asked, do you have a,
In order to serve, I'm going to try to serve the group by trying to have an orderly discussion. I'd like to, I don't want to cut anything off. I want, if people will just save the thoughts that they have. What I'm thinking is we've had a report from our membership chairperson, and we've heard reactions to that report. We have touched slightly on the important matter of the pilot program, which we received a report on, and I'm thinking that we ought to maybe spend a minute or two at least noting that we've received this report and seeing if people have comments on it. And then let's turn to the segue that Joe just gave us about looking toward a change in overall strategy and the various possibilities for change in overall strategy that exist. So can we turn to the pilot program for a few minutes and then resume with Joe's question?
I have a question of the membership chairman. Would you distinguish between state associations and what is the other one? Community associations?
Well, the state association is a Walt Warrior, North Carolina councils make up your state association, aren't they?
Yes.
And a community association is a resident council that wants to give its support to NACRA. The danger in that, and we've had members of this board, God rest their souls, who didn't get the point that the community association didn't mean that the 470 people in independent living are thereby members of NACRA. So we have to do some re-educating, but it may be that, this is my personal opinion, it may be that the community association is now outdated and that we either need a chapter with members coming together and forming a chapter like we're having in Ohio at Bristol Village, are all individual members, because it's a misnomer when the newsletter of Bristol Village says we become a community member, and people think, well, community member means all of us, and it doesn't. So,
And the reason I asked the question is that unless my treasurer lied to me, we were a state organization representing NACRA, and we paid a bill last year, and we're doing it again this year, and you show 0 state associations.
No, 7.
There's
It's 0 joint, the new ones.
Okay, all right, no new ones.
Yeah, but 7.
thank you, Judy, saved me from that one.
Gene, right. Okay. Yes.
Maybe this is inappropriate to ask this question, but I'm here to learn. We literally overnight got nearly 40 members by just having a small group of people talk to others. Now they're asking the question, what's next? We've been saying, well, we're going to form a community and then we're going to go to a state. I'm hearing this and I'm saying, I am totally confused. Because what our focus is, we don't need another community organization. We need a state pushing that stupid state that we live in to take some action. And that's what I'm here to learn. I think the membership issue, is, from our perspective, is a non-issue. You got a great story. It's very hard to figure out from the morass of content that's in the web. But I've been in sales and marketing for over 45 years as a consultant. And I say it's a no-brainer once we get our story together and we're figuring out the strategy. And I don't know what our next steps should be. From what I hear now, well, maybe we should just leap to the state, take these members, talk to some other communities, and go right to the state and not mess around forming a community, because people are asking very good questions. What's the benefit of the community? It really should be the state. And that would make it so much easier, because we're having another meeting with a number of regional CCRCs, I guess they can use that term, to educate them about what we're doing at Monarch. And so I'm here to learn, but I just am confused by the conversation.
Well, your confusion may be a learning thing. You may be right that you should jump to the state association after hearing this discussion. I think that may be what you've learned.
Yes, if that's it, that's okay.
Yeah.
Because I've been reading the document on how do you build a community organization. I'm saying, like, is that the only way? And then I'm really not sure how to form the state, because I don't think that explains it.
Right.
FLICRA, our state organization, deals with issues that affect the lives of people in Florida. And many times, these are not issues in other states. And so we have to have a state organization for our own security.
Please remember that you're talking to the entire room and not just the fellow sitting next to you.
I can't talk very well, I'm sorry. But anyway, the national organization, I've had many talks with Milt Brummer, and Milt Brummer was one of the originators of the national organization. And basically, the national organization was to do nationally what the state does for the state. So the national organization is for all of the United States. And you've got FLICRA just for the state organization.
I'm going to thank you for that comment.
And I'd like to just say this. This little card means I am a member of FLICRA. I have never received anything from NACRA saying that I'm a member, except that little letter that you sent out about some of the things that NACRA has done. And basically it was NACRA U and the newsletter, and I think one other thing, but we've got to do something. The people have to know that, hey, that organization is working for us, and it isn't at this point. I can't see other people.
Dan, I know Marlene's got her hand up, but I don't want to leave Jack, because he's on the frontier, and we've got to stay on the frontier here.
and that is in your packet, there is a news article that deals with the Puget Sound Continuing Care Communities meeting together to talk about, shall we be a state association? And the reason for that is after 2 or 3 years of just talking to each other, they said, if we're going to be a voice of residents vis-a-vis the legislature, we must incorporate and be NACRA, Washington, state of, and be in touch with each other and have a formal way. And the best example of that, FLACRA gets a lot of credit, but another example is the state of New Jersey. And I'll give you their New Jersey report that shows every year they talk about things they need to know from each other. What is the monthly increase? What is the transparency of financial reports? What is the role of residents on boards? What is the pending legislation that is going to help us or hurt us in the legislature? That takes a state association, but it grew up out of the individual communities talking to each other. So it's a both and, both a strong community association, or Jack likes, and I think the chapter has some real merits, a chapter, and the chapters meeting together to make a state.
Anyway, Marlene.
A clarification from my perspective. I have always seen what you're calling community association being a membership by a local residents council. And the reason they get 10 copies of the Lifeline is so that the council members will have their own copy of Lifeline.
That's interesting.
Now, friends.
It's not forming a new organization. It's an existing organization joining.
We have a virtual, non-existent organization. We elect members to be part of our RAC, Resident Advisory Committee, but there's no organization behind that. And up until a few weeks ago, for 8 years, they have all met in private. And that's why it was people were enthusiastic to join, thinking that we were going to do something to solve it, and I kept telling them, no, that's a local issue. NACRA is national. Now that they understand that, they're even more enthusiastic to go for that, but that's where I was having difficulty trying to put together what is a community organization versus the state. Everybody's thinking the state, and that's such an easy way to go.
And it will be for you where you are, it sounds like.
Yes.
Now, friends, I just want, before we continue, I've tried twice to get you to focus on the pilot project report. I don't want to beat this to death. If there's nothing to say about the pilot project report, we'll pass over it. I just want to be sure, in the interest of orderly business, that I allow you to respond and make observations about the written report from Bennett and Pierre about the pilot project.
Could you summarize the substance of the pilot project report? I had difficulty understanding what was done and what was achieved.
Well, the report isn't awfully specific, but Bennett apparently had some way of putting out what he called email blasts. So he had some sort of email mailing lists to which he blasted the news about NACRA. The report makes it clear that although our membership has grown by about 25% in the last year, there's no way to establish how much of the growth was a result of the email blast, which he did, how much of the growth was a result of the project reach out that Bob's been doing, how much of the growth was due to the speaking engagement that I and others have been doing. So we have no way of knowing that.
Has there been any attempt to make that analysis?
Well, I remember I struggled very hard with this board when we were setting up the pilot program last January to be sure that we would not wind up in this situation. But apparently I failed because one of the problems is that Bob and I suppose myself and others of you are following the leads that we develop, and they may be overlapping what Bennett is doing, so unless we sort of sanitize the situation and said Bennett will only deal with these states and Bob will stay out of these states, we'd have no way of knowing this.
Well, we know where Bob has been and you have been,
Right.
and where we've had chapter contact, and we know what members came from those contacts.
Right,
I'm wondering, when Bennett built FLICRA, which he built,
right.
from 700 members to 13,000, was this the method he used? He sent email blasts? Or are we expecting more from this proposal, because it's written or something, than what is possible to achieve?
Right, that's an excellent question. And again, it comes back to the whole question of whether there is an exact analogy between the national organization and a state association. Again, you mentioned that the founders thought there was an exact analogy. I'd like to offer the proposal that we may make a mistake by analogizing the expectations we have of NACRA with the expectations of a state association. The people of Maryland, the people of Connecticut have a much more, you might say, dense interface with their legislators than we will ever have with a Congress. And to assume that this organization at this stage can relate to the Congress in the way that a state association can relate to its state legislature, I think would be a mistake. Our job may be somewhat different. Our job is a job of being sure that one state knows what the other state is doing, and one state can learn from what the other state is doing. And that our job is a mutual education job, and that the job of affecting the Congress is somewhat down the road. The Congress, when it held hearings, the Senate, when it held hearings about a year ago, or maybe a little longer than that, concluded that it's better left to the states. We just don't have enough people in CCRCs to elicit the interest of Congress. Yes, Jack?
I think it's a mistake to conflate national with congressional.
Right.
There are several examples, Walt Boyer's alluded to some of them, of uniform codes among the various states that keep the regulation at the state level. And that's where the real opportunity is. And what the Senate said was the states should gather together and do the job. And, I think from our perspective, residents everywhere in whatever state have a right to know what to expect when they enter into a continuing care contract and turn over their life savings to the care of a third party. There needs to be a framework so that people know what they're getting. They don't know that now, and when things go bankrupt, they don't have a real voice in the bankruptcy. And these are all issues that can only be addressed on a national level, and we need to build the mechanism to do it. To do that, though, is going to cost money, because as Joe has pointed out, older people are just not, they don't have the time horizon to be able to accomplish the job that, say, ARP accomplishes with its massive staff over time. So we can do it, and we can get uniform regulations among the various states without involving the federal government. So I think it's a mistake to say the National Association is the federal association. It's not an inside the Beltway organization. We're still out in the state capitals, but we're trying to get something so that when somebody buys a CCRC contract, they know what they've bought, and they have assurance that it's going to be fulfilled, and they're not going to be exploited financially with their life savings. And right now, we don't have those assurances. And they also need assurance so that when there is a bankruptcy, they're protected from harm. They're not at the bottom of the totem pole.
And are the model laws our offering in this area?
Well, we've come forward with the Bill of Rights and the model laws. Those are our two approaches. Walt's pointed out that we have a uniform electrical code. We have federal highway standards. When you drive from Tennessee into Kentucky, the lines on the street aren't suddenly different. They all follow national standards. Those things are it's possible to achieve. right now, there's no uniformity. So in Florida, they have one set of laws. North Carolina, they have another. Both states are very proud of their CCRC laws. The two sets of laws are not consistent with each other. And so when people buy in one state or the other, they don't know what they're getting.
What do you propose?
And how does this translate into membership?
Well, we've got to convince people that they have that need, and that's difficult because people move to these places to have peace of mind and to retire, and they want to believe, well, gee, I got what I thought I was going to get. And I don't confuse me by upsetting me by telling me maybe it didn't work out that way. You know, I'm hoping it all works out for the best, but I'm near the end of my life, and so that's our challenge.
Jennifer is a good example across America.
Okay. All right. I'm going to now assume that we've said what we need to say about the pilot project report, and we'll now follow up with the other things that we are considering. There are other aspects of the membership issue which we haven't touched on. One is, Joe, if you want to report to us on the Cigna initiative, just where it is at this point.
Well,
explain also the general idea. And then
okay. The idea is to give it, recognizing the very limited resources that NACRA has, to reach out to a population of 650,000 CCR residents across the country. We should partner with organizations that have those resources in circumstances where there's mutual benefit. The business model tracks along the lines of AARP and the relationship with United Healthcare. By having membership, joining AARP, it gives you access to products and services that are attractive to a senior population. Everything from supplemental health benefits, reaching beyond that to discounts in hearing aids and discounts on automobile rentals. So there's real tangible value that's associated with joining AARP. There's another organization that was formed a couple of years ago, the Association of Mature Americans. It was started by an insurance broker in upstate New York. Over a period of 2.5 years, they've added something like 2.5 million members into in their program. Cigna, one of the Cigna companies, is a supplier to that organization in terms of certain benefits. So Cigna sent a man up from Texas who is responsible for coordinating the various products and services among Cigna's affiliated companies. And he spent a better part of a day at our facility at Seabury. And I gave him an opportunity to speak with some of our staff members that deal with resident health insurance issues. An example of that is that if they opt out of standard Medicare, they go into a Medicare Advantage program, we make sure that that particular underwriter recognizes Cigna's health services as a participating member. Otherwise, they have to pay that out of their own pockets. So he had an opportunity to understand the needs of the residents in the community. He had an opportunity to see firsthand the kind of lifestyle, the commitment to an active lifestyle, emphasis on health and prevention of care. And the concept here is if Cigna would buy into that, we would form a partnership and collaborate together, whereas they would endorse the CCRC concept and encourage that. And to residents now in CCRCs, that if they became a part of it, supported the CCRC concept through membership in NACRA, they could benefit by access to products that Cigna has and its affiliated companies, much the same way as it works with AARP. Well, he took all of that information back and conferred with his superiors, and the bottom line is that we're too small. You know, our membership, 1,300, 1,500, you know, vested cap, and, you know, no really discernible program for being able to reach out to large numbers of people. This does not work. And the questions that remain now is, and I've asked Cigna to clarify what would be a minimum size organization. Judy Moss had a good suggestion. Perhaps this is more viable if you go to Florida with 13,000 members of the program down there. Now we're talking about money. It may be more feasible to structure this for a state association, where it's not feasible to do it with a national association. So that's something to explore. Another opportunity to perhaps look at is talk to other vendors. Humana, example, see if there's interest there. In my opinion, that's a real long shot, because the concerns that Cigna has, Humana has, and I don't really see that going anywhere. From my perspective, until NACRA figures out a way to get the resources to reach out to the national market, we're not going to grow any faster than we have been growing in the last several years. We need to partner with someone for mutual benefit that has those resources. And maybe there are other organizations, associations that have resources that share our goals that are not necessarily in the insurance business. So, you know, some more market research could be done on that. Or do we just put this whole business model on the table and say, let's get settled first what we want to do and how we want to do it before we go back out and try to solicit the partnership with organizations that have a lot of resources that we do not have, or figure out another way to get resources. The way we're on now, the track we're on now, I don't think we'll have enough money to fund attendance by the officers at the next annual meeting. We were greatly dependent for several years on contributions. We're still the beneficiary of that. But that's going to go away. You know, it's unrealistic. We have to figure out a way to support a national organization out of dues that come from individuals.
Are there questions for Joe? Yes, Paul.
I would like to ask Joe if he has a couple of numbers for me. And these are goals that we might challenge ourselves with for membership. The two questions I have is, what membership level do we need in order to attract an organization like Cigna?
That's a question I put to them, and I haven't gotten a response. I emailed a message to Brad before I came to this meeting, and I told him I was anxious to have those numbers, you know, the minimum kinds of numbers, but he hasn't responded yet.
They did answer us, though, when we talked to them, was it 2 or 3 years ago?
Yeah.
Yeah, we had a conference call with them that I was on. They said 50,000 would be the minimum for them to do anything that would provide a special value to NACRA members.
Okay, that's a good number.
And to clarify that a little bit, when we had those discussions a couple of years ago,
Yeah.
Jack participated, at that time, Cigna was more dependent upon group products. Since then, through various acquisitions, they have vastly increased their strength to deliver individual products, avoid group products. And so the number may be lower, but I would guess it's not going to be significantly lower than that. Because it's you know, it's.
Well, that, you know,
Yeah.
that's a good target.
Yeah.
And the second question I had, I know we're not gaining enough income from our membership right now to really be able to afford a manager like Bennett. What membership do we need in order to be able to honestly afford that without having to rely on donations?
I don't know the answer to that.
I'm trying to put that together for North Carolina, and I think it's a number.
Well, you know, frankly, in my opinion, you need to sit down and spend a couple of days working a strategic plan, put it all together, you know. Do we ultimately want to grow to where we have our own paid executive director? Do we want to have lobbying strength? What are our objectives? How are we going to serve? What's our vision for serving members across the country? Until we are clear on our goals and our missions and how we want to get there, it's hard to determine how we're going to fund all of this. Another possibility is that I understand that John was looking at the foundation money to help fund this, and I don't know whether
John has developed a case statement, and I think he submitted it to a few foundations, but it's much too soon to expect a result. I mean, when you're dealing with foundations, you're dealing with negotiations that can spread out over 6 or 8 months. So.
I've talked with some residents in our community that have expertise in fundraising and getting foundation money. And they've suggested to me that the biggest challenge is to be able to demonstrate to the donor that you have an effective plan to grow your business.
Right. Are there any other questions for Joe? Okay, let me just say one or two things more about this matter of membership. And I realize I've been trying to watch the clock, we're taking a long time on this, but it nevertheless is a key issue for our organization. Again, I'd like to reiterate the point I made earlier. Unless NACRA has the name and address, and hopefully email address, of a member, their use to us as a membership is strictly limited. It's ephemeral. So in my efforts, have been focusing strictly on individual memberships, life memberships, or whatever.
I need to interrupt you, Dan. In your report, there are 340 names of people who will be dropped from NACRA at the end of September, at the end of October. And those are names, addresses, and phone numbers of people in your states. And we need personal follow-up with these people. You have those, the board members has the report. And again, the strength is in that individual relationship.
Exactly.
Yeah, Bob, since you mentioned that, I noticed that the lapse rate has been increasing dramatically from year to year. Over the period that Bennett has been handling the administration, the number of members lost seems to be increasing. Is that just a result of improved record keeping, or is there something else at play there?
I do not know. We have improved record keeping, but I can't tell you what's behind it.
Anyway, there's one angle which I haven't heard discussed in the board. I haven't been a member of the board that long, that I've been pursuing, and I'll share with you the kind of initial things I found out, though I'm not really prepared with a plan or a budget. But one of the things that occurred to me is that, and I'm again thinking of 600,000 people and the ability to reach them. The United States Postal Service has a program wherein businesses can target carrier routes. That is, you don't have to send to a whole state, you can send to a carrier route. Carrier routes vary in size, but typically they are about 500 household addresses. So the question is, can we identify carrier routes which contain CCRCs in large measure? In other words, if a carrier route is 500 people, and if there's in that carrier route a CCRC with 300 people, by addressing mail to that carrier route, you would, in effect, hit all the members of the CCRC.
To be clear, Dan, if you had those names and addresses,
Yes.
you would conduct a direct mail campaign.
Right.
Okay. In Florida, we have the names and addresses for 13,000
Right.
individuals that are associated with the CCRC. We have 319 members.
Right.
Could we borrow from the Florida Association their address and undertake a direct mail campaign to see if it can be effective?
Well, we can ask Florida. That's a very good.
Yeah.
That's a very good suggestion. So one of the things that we can do is we can ask Florida. I don't think we can ask Florida to give us their list of names. I think a mailing list is a very precious entity and is not distributed, but we can certainly ask Florida's cooperation
Sure, yeah.
in using their list to get a direct mail campaign
Yeah,
to their members.
It may be proprietary.
That's right.
Yeah.
So that's a very good suggestion, Joe. So one of the avenues we can take is to try to use the mailing list of the existing state associations for a direct mail campaign. But the other possibility is that it is possible in the states where there are no state associations, for example, to use this method.
Yeah.
Now, the problem the issue we will have to face, and I'm not yet prepared with exact numbers, but there are several issues we have to face. One, it may be a somewhat labor-intensive job to identify the carrier routes in which significant CCRCs are located, but it can be done fairly easily. The second is, there is a cost in that to get the labels, for each individual house, it might cost 5 cents a household, and then you have to develop your printed material, and then you have a mailing cost, which could be as much as 17 cents a household, could be as low as 9 cents a household, depending upon circumstances. So this is as far as my research has gotten, but I do want to try to pursue it a little further, because it seems to me that if we can get a good case statement together to individuals, and we can reach individuals, we might be able to locate the champions we're looking for among the first registrants if we can hit individual CCRCs. The other advantage of this program possibly is that it can be done on a small enough scale that we can test it out. We could pick 5 carrier routes where we think there are significant CCRCs located, and we could do a mailing to 5 carrier routes in maybe 5 different states. And we might find that the return is so low, unless we get enough dues to offset the cost of the mailing, it wouldn't be worth it. So you'd have to see if the dues that came in offset the cost of the mailing, and you then had a member who might renew, you would have done it. But if the dues do not make up the cost of the mailing, we have to say this is not a productive.
I think that's a great idea. And it's an example of the kinds of things this organization needs to do to grow our business at a significant rate. And I would suggest, as you look at those sources of address, Ziegler has a ton of information, an inventory of CCRCs across the country. They can break it down by zip code, they can break it down by size, the number of independent units, the number of assisted living units. You can target. If you want to try to reach out to the largest CCRCs, there's a list, the top 25. The ton of material that's available to help you find that address that's listed you're looking for, and to target the areas that are most apt to be productive.
Thank you.
Go to their booth.
Okay, good. Anyway, so that's as far as it's gotten. It's only, the other thing I maybe should mention is that I've been working on the Bill of Rights project, and you may remember when I first introduced this to the board, I guess about a year ago, the idea I offered was that I would like to try the experiment of using the Bill of Rights project as a way to engage people first and seek their membership second. In other words, we're always saying, what are we delivering, you know? And my thought was, well, if we get people engaged in a process of drafting a Bill of Rights, they would get familiar with us and get to value us, and then we would ask them to join. I have to report that this has fizzled mainly on the shortcomings of my own time and energy. I just haven't been able to pursue it.
But it hasn't fizzled. From what you've written, your writings have motivated people in sleepy Seattle and has activated the communities there. They brought Catherine Pearson out, and exactly what you hope would happen, happened. So don't be discouraged.
Okay. Well, anyway, thank you, Bob. So I sent a mailing to every CCRC in New York State, which is the next door state to where I live. I picked the state because it was next door and I could conceivably travel to it without incurring a lot of costs. And I also picked it because there were only 11 CCRCs in New York, so it was manageable. I have to say, so I sent Bill of Rights discussion kit to President Residents Association at each of these CCRCs. 11. I got 0 responses. In other words, it did not produce any response from the 11. So I was next going to try Pennsylvania, which has 170 odd CCRCs. I was going to try to do at least some of those. I just haven't had the time or energy to try that out. Now I have had big response from one New York State place, the place that went bankrupt, Amsterdam at Harborside, but it was not due to my initiative. It was due to the fact that a resident there knew a friend of mine who knew me and got me out there, and I addressed a group of about 200 residents there about 2 weeks ago, and I came away with at least an address list of about 50 people.
And a resident there has a sister at Mirabella in Seattle who was present for Catherine Pearson's discussion of resident rights.
So, okay, so Bob is convincing me that the word of mouth works. But anyway, so what I don't know where I'm going with this exactly, but I will continue trying both these things, trying both using the Bill of Rights program as a way of getting people into our tents before they become members and then ask them to be members. And I will continue searching this direct mail idea with 2 very good ideas from Joe Ziegler and state associations, in addition to the attempts that I've been making. Marlene.
In New York State, I would suggest that you go back to Canterbury Woods via Len Sikora.
Okay.
He was the membership vice president, and he recruited many, many members.
Great.
He was highly respected, and I think you would get a response from him.
Thank you. I will do that. Yes.
I'm sitting here listening to all this, and based on my background, I would say it's virtually impossible to go after 600,000 CCRC residents with no budget.
Right.
But it's very possible to take Bob's job and split it up into 25 pieces in 25 areas, and I don't know if it's 25 or 50 or 10. But you need regional or district membership managers. Some people who will raise their hand and say, yeah, I'll do that either in my community or in the town where I live, because there's 5 of them there, and get them to be the leaders in your local area. And I think, just trying to multiply myself, that's what I would do. And that's what we're starting next Tuesday. When I get back, we've got a meeting of 4 CCRCs coming to our place, and we're going to talk with them, among other things, about NACRA.
Great.
And so all you need is somebody with a little bit of energy who says, yeah, I'd like to do that. And I think the Bill of Rights that you proposed is a very good selling tool, because that's how I got a number of people we were probably one of the first ones to respond with saying, looks good to us, but then we had nothing to weigh it against. But that's a very good selling tool to say, here's what we're all about, this is what we're trying to do, and along with the rest of the story that you all know.
The other thing, I think we have to take advantage of every opportunity. We have resident association meetings, or the management has meetings with residents. At Deerfield, we get up and talk at every single meeting. We get members every time we do it. On last Tuesday, Deerfield hosted the Western North Carolina Roundtable, which is the presidents and vice presidents of 7 local CCRCs. They invited Walt Boyer to speak. Don't miss these opportunities that are right there.
The problem with that at our place is we're not allowed to speak at those meetings. Those are just for the 10 or 12 people on the board.
Peachy keen.
That's why we need a Bill of Rights, right?
Right.
Your residents' rights can have some rights in there, the ones that we came up with, specifically say the residents have a right to speak up.
Well,
I don't think he's talking
or-
about-
Or after the meeting, you can't talk during the meeting, and you can't talk at the meeting. So you have to contact, if I want to follow up with you, I have to be quiet at the meeting and then talk to you afterwards.
Yeah, he's not talking about the provider limiting him. He's saying that the members of the resident council are holding a closed meeting. Because we went through that at our CCRC, and it almost divided the place, because some people, yeah.
Okay. Friends, I'm trying to serve the group here by keeping us on track and yet not cutting off discussion prematurely. I wonder if we can consider that we've thoroughly threshed the issue of membership.
No,
Okay?
the elephant in the room, if you haven't seen it, is called leading age.
Oh, yes, go ahead.
Leading age, as you know, Marlene is on the board of Humpty Dump, what do they call it, the governing,
Not anymore.
not anymore, right?
I was.
Did they throw you off?
No, they had a very discreet way of getting rid of us. They reorganized and have a different body with fewer members.
Anyway, so if you read the leading age third agenda item, engaging, they call it consumers, we are the consumers that pay the bills, it talks about providers engaging residents in their expectations, their changing needs, the new day. It's an eloquent statement that Jack and I know is totally ignored, all right? But they got it in writing, see, that's the start. We've had one meeting with Larry Mennix and Steve Magg, the 1 and 2 guys, about how the two of us can work together. The problem with membership in the none zone, N-O-N-E, that is where we were at 0, or maybe now we're at 9 in New Mexico, is that providers are just threatened out of their gourd, while he doesn't get any response to his communications because the provider just doesn't forward it. Mel Grossman wrote 15 CCRC resident chairs in Ohio. He got one back, and the executive director said, "We're not interested." Notice the executive director responded to his letter to the resident president. So it's a mixed bag. It's fraught with peril. But if we could even exploit a little light with leading age and get some name brand recognition among providers, it would be a start. And in coming here and making these visits, I took the leading age program and the eloquent invitation that Larry Mennix wrote. "Dear NACRA members, we look forward to seeing you. You are on the cutting edge
you are exactly what we're talking about, and examples of re-examining, reimagining, and it went on, and up in Bristol Village, Mel Grossman says, that reminds me of Flip Wilson, who says, don't write a check with your mouth that your body can't cash. Well, they've written the check, but they haven't cashed it, you know, but it's still something we've got to look at, to where we'll be seen in some cooperative light, and we're not going to sell our soul, and I'm as upset they canceled our luncheon program because they didn't like the speaker, and you know, there's some real peril in it, but there's some real possibilities, and I'm ready to say, let's see if we can find some possibilities. It's like, whether it's Cigna or the direct mail, let's look at all the options. This is one option, and I really don't know where it could lead, but it...
Bob, we do have a track, a leading age track, which the next step of which will be a meeting among board members of NACRA and representatives of leading age in connection with the peak event, which is coming up this spring. So it's moving a little bit slowly. We have been through a serious negotiation with them over some kind of relationship agreement, which now is tabled temporarily because we couldn't come to an agreement about verbiage. But we are still pursuing leading age, and you are absolutely right. If leading age could be another avenue of access to the 600,000 people. Obviously, we can't do all 600,000 at once, but you know, they might be an avenue, and so we are still working on that. And as I say, the next step will be a meeting between us and leading age officers in the spring. Yes.
Could we take a 3-minute bathroom break before we go to the next topic? That might be a good way to get us to the next topic.
You anticipated my very thought. So we've been meeting almost for 2 hours, and it is time for a break. So why don't we take a 10-minute break? I now have it's 4:20. Why don't we reconvene at 4:30, and we'll go to the next agenda item.